Hello, everybody, and welcome to this session, Barriers to Screening and Testing in the Pacific Islander Community. My name is Jaime Carrillo, Planning and Strategy Consultant for Champions for Health, a part of the San Diego County Medical Society Foundation. Joining us today are Kenson Alik, the Director of Micronesian Education for Liver Wellness Program, MELWP, and unfortunately unable to make it today due to illness, but who has sent ahead recorded slides, is Melissa Lailan, Chief Executive Officer of the Arkansas Coalition of the Marshallese. Thank you for joining our session. I will be moderating our chat here and looking at checking over comments and looking over our session. So at this moment, just thank you again for being here, and I'm going to turn it over to Kenson to introduce himself more fully and tell us about his program.
Hi, good morning from state of Hawaii. Aloha, Yakwe. That's my greetings. And so I'm here to speak on about our Micronesian Education for Liver Wellness. So welcome. And so we are part of the F3 Hawaii, and that's one of the collaboration like teams that are all working together to eliminate hepatitis in our strategic plan that we will talk a little bit about it. So we're ready to move forward. Next slide, please. So the F3 Hawaii has just created a elimination strategy 2023. And so, as I mentioned earlier, Micronesian Education for Liver Wellness is part of that efforts and take very active role with the Micronesian community here in the States. So next slide, please. Through F3 Hawaii, we developed 5 priorities to eliminate hepatitis. So the priorities are in the wheel, as you can see. First off is awareness and education, then access to services, advocates at all levels, equity in everything, and of course, data for decision making. So those are the main priorities, 5 priorities that F3 Hawaii has created, and so Micronesian Education is part of that. Next slide, please. So under each priority is strategic directions that we need to follow. And so that's 2 of those are highlighted there, and that's basically under micro-elimination opportunities. And so that's basically where we come in place and play a very important role in trying to make the efforts and inform and educate our community. Next slide, please. So MELWAV, Micronesian Education for Liver, is an important equity project to eliminate hepatitis here in the States. So we fall under many of these strategic directions, especially leaderships and people first. We consider people first. So we try to respond to the needs and especially to try to eliminate that hepatitis and cancer in the States. Next slide, please. We're doing a lot of education, and so that's one of the recent Zoom meeting we had with our community leaders. And mainly we set up when we first tried to connect with the community leaders such as kings, queens, royal, the traditional leaders, and also church leaders, and to try to organize when the best times in the schedule that is more convenient for them, so we can always come back and then meet up with them and the rest of their constituent, like their stakeholders at their church, at their communities, and all others that are interested. So we open it up for everyone to join. So we will go over some of the numbers that we've been able to cover since 2015, and until today. So some of those are outreach through the online, and some of them are in person. So we will go through some of those. Next slide, please. We realize that there are some major challenges that we need to accomplish and try to work around, create some solutions and remedies to those challenges and barriers. So, for example, language is one of the main or major challenges. So we partner with some of the, like for example, Language Access OY, and to try to help with translation of materials and things for our education outreach. And so that's really they can read on their own and understand their own language. Beside that, Rensselaer is my wife. We partnered together. She speaks Chiquis language, one of the federated state of Micronesia nations. So she's able to speak her language, whereas I speak my own, Marshall Islands. So more of them then able to come join and to listen to the, have talk stories when we schedule on a monthly basis, or when we do the like bigger for community outreach meeting with them. So they're more of them. They're so interested and try to be part of that and listen and learn. So that's Nick. Bring us to the next slide, please. And so we also realize that medical insurance it's also a problem, because many of them just move, to the States, and so they don't have access to medical insurance. So we help them, refer them to those providers. For example, we are Oceana and Legal Aids Society of Hawaii. So those are the two groups, nonprofit organizations that help with the registration for medical insurance. So once we secure that, then we then move on to help with the scheduling with their doctors and specialists. So that's a pretty much kind of time consuming to try to organize and plan alongside with them and help them to be successfully secure their medical insurance. I'm also a member of the COVID-19 RMI task force, and so we do a lot of education, Zoom and WebEx, and so we talk to our leaders and every other members of our community to inform them of what is available, what kind of resources out there that they need to, take advantage of, and also scheduling vaccines so they can complete their vaccine. We help them register online or do the paperwork for them. So a lot of volunteering, and go out and try to meet up with them to make sure that they have insurance set so that they can be able to move on. We also do radio announcement. That's on a monthly basis. We schedule radio program. So we come forward and partner with the radio station, local radio station, so that we can be able to deliver those messages and inform them ahead of time or what's up in the following months, what is important that they need to take note of. A lot of listeners. That's one of the populars, and also we live stream on YouTube as well while we're doing the radio broadcasting announcement or education and outreach. Next one, please. lack of education. So we realized that after our outreach, we run a short survey just to ask them how familiar are they with the subject. Do they understand? Have they heard about hepatitis and also liver cancer? And many of them, about 87 to almost 90% of our participants, they said that they have not first-hand information. They just realized they just learned about, and so then we wanted to make sure that we try to ask them what is the best plan or schedule for them, and how can we be best address those needs to be well informed. And so talking to the leaders, for example, one of the sport, very popular sport lately in Hawaii is tennis, and also men's softball, volleyballs, all those for local folks. So we try to hook up and get to them. And as you can see, I'm with, and Thaddeus also, I invited Thaddeus Pam from Afri Hawaii to come speak to us. And so Hepatitis was able to sponsor one of the recent big tournament, about 70 to 80 folks that they came with their family. And so we have to set up a time to have a talk with them and go through the materials and inform them about screening available for them and how we can be able to connect them with their screening clinics and things like that. So those a lot of exchange, and some of them came forward, to talk about, I feel that I need, because my family, keep dying from hepatitis, and we're suspecting that everybody else is just having it. So we try to set them up and respond to them. So during the games, we provide foods, gift cards, and also other incentive like prizes. So that's how they're able to really kind of get motivated and try to get involved in the games and be part of that. So that's very attractive. Next slide, please. We try to advocate in all levels, so locally, national as well. So this is a moment where we meet in DC with our Hawaii Senator Macy Ronald. And so she was very impressed of the Microns in Education for Liver being able to address the needs for hepatitis with the Microns community and the rest of the Pacific Islanders here in the state, because some of them, they wanted to adopt the same models and education outreach program that we have. So we continue to meet on a monthly basis and even phone call to our clients. We set up IHAC, and that is Individual Happy Action Coordination. We jump on them right there and then continue to be followed through and help them with language and with filling up forms, and then connect to their specialists and even pharmacy to get their medication. And that's one of the biggest concern at this point during the COVID, because I probably will go on to the next slide, please. And that would be like some, they don't have any access to internet at home, so there is no way they can meet up with the doctor for their telemedicine appointment. So there are more and more challenges that you continue to realize and work through, try to resolve those problems. So here's the University of Hawaii sponsoring one of the Pacific Islands forum for youth and families, and that's include they invite providers to go share with their attendees. So we wanted to be part of that, because that's where we're able to connect more and be able to make our program accessible to everyone to understand. So I discussed a little bit about the technology problem they have during the COVID. And so that's where we come in play to try to help them how to connect at home and, do a walkthrough and help them. Some of the patients, they have expired prescription. And so we have to say, okay, give me your PCB contact information and I will try to call for you and set it up. So finally, they're able to go on and pick up their medications from their pharmacies and continue on their med plan. Next one, please. So that's no more, Jake. Next slide, please. Okay, so that's I talked a little bit about the COVID-19, and so again, those are some of the things that we help set up and continue the outreach and do online Zoom as well as WebEx and meet with them, show them how to create their um, uh, like WebEx access and Zoom access. So first, you know, they learn something during the COVID. So we take advantage of that COVID outbreak and pandemic because we're able to stay home and learn something new. So um, we continue to call them on a monthly basis. Sometimes I spend out of my work hour because they called my phone and I have to respond during work hours and try to say, okay, I'll be in at 12, so come back at 12 or 4 o'clock so you and we can discuss. And then I will try to hook up your a nurse or even the doctor and try to see if they can be able to help. And I can translate the needs for the patient. So that's pretty much what we continue to do, and we're able to do. I think that's pretty much successful. Next slide, please. Okay, so since 2015, about 70 sessions that we do not only on Oahu, Honolulu, but across, the like outer islands like Kona, Maui, Kauai, and all the others. Uh, small communities in those islands. So we go from places to places to try to get the word out. So that is the number, and also as I mentioned, that's monthly, virtual, or in persons. During the COVID, we counted about 300 plus. We were able to reach and spread the word to them. So that's pretty much popular because word of mouth as well. A lot of them, friends to friends, family to family, try to share, and so we see them next session. We realize they all wanted to listen and wanted to learn more on that one. Next slide, please. So my way of saying thank you, komol, and my wife's language, Kinisho. That's Kinisho, and mahalo, of course, from the Aloha states. So our contact information we share with them, and so they're able to book, and we continue to provide the service up until this point. Thank you, and I'll be open up with any other next slide and see if there's something in the next slide. I think that's Q. Yeah, that's our contact info. You can go follow us. And
thank you so much, Kenson. There are a couple questions here in the chat. Seeing that it's 12:38, perhaps we can play Melissa Lyland's video, and then we can follow up with questions. But Kenson, if you want to check out the chat and prepare those up, we can have those answers ready for folks after the next presentation.
Sure, thank you.
Thank you so much, everybody. We had to cut Melissa's video just a little bit short, but we will share that out with the screen. We wanted to have enough time for questions here. Thank you so much to all of you. And Kenson, we did have a couple of questions here in the chat, and one of them is what kind of games you were able to interact with your community, and then if you had any patient anecdotes about stigma regarding liver cancer or liver disease in the Pacific Islander community. And if you'd like to just direct your questions as well to Melissa in the chat, we can get those out to her and have that responded back to you. Thank you, Kenson.
Thank you for the questions. Game that I play, I joined the veteran basketball, older folks, 40 and older men. So many of them, they're from the islands. They don't know about hepatitis B and liver cancer. So I take time and provide, again, incentives as well as schedule refreshment and during the intermissions when we have a break time. And also softball. I used to play softball, but now I go to the field just to help out as a umpire and referee and coach as well. So I take time and make sure that all those teams that register for the tournament for men's softball, even the women's volleyball, I should be able to have time with them. So schedule time aside, and it's like part of like, you guys register, you make sure that you attend on Saturday, about 1.5 hours that we have to talk story together. And so that is the subject. And so that's really get everyone involved, and that is workable for our kind of a planned schedule. And on the stigma side, questions. Yeah, maybe I'll start out with myself as a survival. When I first begin to think, about the struggles and the best devastating experience that I had, I thought I'm a Christian believer. I thank God for giving me the second life, and so I said I'm gonna become a storyteller. I'm gonna advocate. I'm gonna talk to them, especially my community. They are dying, and nobody knows. They don't know about that disease. So I approached my family. Some of them, they were resist this, and that's a cultural thing. It's taboo when you try to expose your family and talk personally. It's very shameful. And so I said, well, I think you guys are seeing in the negative kind of way, but I think should be able to save life when I finally get on and speak up. So I went ahead and put down plan to move on teaching and talk with family, friends, community, and go larger, bigger group. And so it works. So I think it's time to, I try to continue to speak up to the leaders, especially the community leaders, the kings, queens, to buy into that. And they finally realize that is important because many of them dying, their family members, their children. So they wanted to be part of that efforts, team up with us and help set up. And so they go ahead and bringing their people together. And so that led to, everybody try to get involved and listen. So let's change the mindset. Let's change our taboos, kind of a belief and myths, and let's come forward and face the reality. And we speak up, and we have to be openly and honestly and not to hide things, but just to share some of the chronic illnesses among us and be able to talk and others that are struggle and they are not able to talk, then they benefits from that. So that's me and others. They said, well, again, those kind of ashamed family are try to hide it, and individual as well. And so, and they don't have any, like for example, maybe not ready to come forward to talk because of their education level, I would say, or socioeconomic background and all this. So a lot of things, factors that play into the role of not being able to confront and come forward. So I hope I gave some of the answers to the questions. Great question. Thank you.
Thank you so much, Kenzen. And thank you for that question. I think stigma is something that's going to continue to ravage our communities just in general, but specifically when it comes to disease states where you might feel like you did something wrong or I did not do the right thing. And what a great way to integrate chronic disease education with physical education as well and health. I was definitely expecting a board games kind of answer, or we play, but softball and football, I think that's a great way to engage folks also with their body and with the larger aspects of health. I wanted to thank all of the attendees today, and also Kenzen Alik and Melissa Leilan, our presenters today. Unfortunately, we are out of time, but I want to just uplift what I heard today was the importance of these micro strategies in micro elimination in reaching hard to reach populations, because I think we often get stuck in this numbers game and we only look at the output, and being able to focus in on specific populations and specific groups is that's what the care cascade is all about, right? And making small steps towards large elimination. Thank you all for your day. I'd like to give you at least 5 minutes to enjoy your break and the cocktail session. Again, please do direct any questions that you may have to myself, the moderator, myself, or Melissa, or to Kenson. And thank you again for your time, and thank you for your presentations. Have a great day.
Thank you.
Thank you all.